A very big hello to all my dear students. So, how are you all? I am starting an alphabetical series in your favorite channel, You and I with Dr. Ruchi Rai. So, in this what we will do? We will pick one alphabet. What is the important condition asked in the exam? We have to know the basics and we discuss a PYQ. All the topics that are going to be selected, that I have selected alphabetically, are your PYQs. It could be any exam. Okay. So, we start with A. We will study here accommodation. What is accommodation? I think this is very clear to you all that when you are looking at the far, you need less refractive power, and when you look at the near, you need more refractive power. So, this automatic change of the refractive power when you are looking at the near, that is what is called accommodation. Accommodating the refractive power according to what distance I am looking at. Is it clear? Okay. So, what are the steps of accommodation? Right. We will come to this little later. First we go with my style. We make a diagram here to understand the steps. First of all, what will happen is contraction of ciliary muscles, right. So, when the ciliary muscles will contract, this is plicator and plana. So, first step is contraction of ciliary muscles, and this is going to lead to relaxation of zonules. This is relaxation of zonules becomes your second step, and this is going to lead to what? We will say mild increase in curvature of lens. That is your step number 3. So, contraction of the ciliary muscles, relaxation of zonules and mild increase in curvature of the lens, and we all know more the curvature, more is the refractive power. So, the refractive power is going to increase. This is what is accommodation, right. Okay. So, once we know this, now we can look at this to understand better. Whenever there is a muscle contraction here, the ciliary muscles they contract, this causes relaxation or slackening of the zonules, and there is bulging of the lens surface, right. Whereas, reverse is happening in an unaccommodated state. The suspensory ligaments are pulled tight, no contraction of the ciliary muscles, and the lens is pulled thin. I think this is clear. It should be absolutely clear to you. It is a very important topic. Right. Okay. So, once we know what is accommodation, of course, after the age of 40 years, what happens? Let me mention this as well. After the age of 40 years, what will happen? Your ciliary muscles have become weak. 40 or maybe more than 40 years, ciliary muscles become weak, and elasticity of the lens is also less. And because of that, what happens? There is error of accommodation, and this error of accommodation is what we all know presbyopia. And how to manage this? We want to increase the refractive power. We use near glasses or convex lenses, but is only for near. That is why we call it presbyopic glasses or near glasses. Now, I will be discussing on this important topic. Based on that, one PYQ in your exam based on this topic, accommodation. So, we will solve this question. So, every time in this alphabetical series, we pick up a letter, we discuss the condition, some topic, and a question related to the topic which has been asked in your exam, right. Hope you will enjoy it. So, a 70-year-old patient who was using presbyopic glasses for the past few years is now able to comfortably read the newspaper without glasses, right. So, what is the most likely diagnosis? I think there is some, I do not totally agree with this. Had it been a 60-year patient, I would have been more comfortable with this description. To be very honest to you, maybe there is decrease in the reading glass than no glasses at all. Okay. So, there is little flaw in this. I would say the language of the question. I wanted to put this in front of you, so I am telling you. So, but there has to be some mild that there will be betterment or there is improvement in the glasses. Here in this case, in this patient, there are no glasses are required. So, what is this called? First of all, what is this called and what is the most likely diagnosis? I hope you are clear. Let us go back to this diagram. This is what is called second sight of old age. Any improvement of presbyopic glasses is called second sight of old age. And why is this happening? Let us discuss that. What is happening in old age when patient is actually developing nuclear sclerosis. And when there is a nuclear sclerosis out there, naturally the refractive index is increasing. So, power is going to increase and overall power will increase in the eye, and therefore, I need lesser power on my specs. Got it? So, this is what is second side of old age is due to index myopia. Power increase means what? Myopia. So, it is due to increase in refractive index, so we will call it index myopia. This question has been a very recent question of almost all the exams, INICT, NEET, PG, FMG. So, I hope it's very, very clear. That's why I picked up this topic first. This is the basic that should be absolutely clear to you. What is second side of old age? What is presbyopia? Please remember, it's not an error of refraction. It's an error of accommodation. Right? Hope you enjoyed. Thank you so much. Stay blessed and keep smiling.